training in general adult psychiatry. I have since then received additional training in addiction psychiatry, forensic psychiatry, and geriatric psychiatry. I try to make the best out of use of treatments which are effective from a medical model, as well as from therapies and counselings, and getting the best out of the wisdom that's around. The show itself is going to really focus on many aspects of very simple things which are around us, resources which are around us and within us. And oftentimes we can become so bewildered and anxious about small happenings in our life that we lose track of some simple solutions. And our attempt is to really empower individuals rather than have them dependent on medications and so forth. So the idea behind that is really teaching a common individual like myself and yourself very simple solutions to what may appear complexities of life.
I'm a professor of deaf education at Indiana University of Pennsylvania, and have had the opportunity to actually work with Dr. Chaudhary through his DBT program, and it just made a huge difference in my life in terms of dealing with stress and anxiety and depression issues. I'll tell you, the economy is what's really on my mind. It's had a huge impact both on me personally and professionally. I've seen a number of things happening at school that are very distressful to me. I have students, for example, that have to work 2 and 3 jobs in order to just stay at the university because their parents are laid off or have totally lost their jobs. Because of that, they're exhausted, they're depressed. They can't concentrate. Sometimes they have a hard time coming to class, and so that really impacts their performance significantly in the classroom and then professionally as well.
Not only people who are coming in seeking professional help, but also people who are staff. I have nurses who are struggling with layoffs and cut down on the hours and so forth, or their spouses having been laid off or being threatened to being laid off, or reducing income in the total household. So yes, people come in with simple issues such as sleep difficulties, worries related to children, and healthcare coverages and so forth. So there are many folks coming in not as diseases per se, but as an outcome of stress that many people are struggling with. And usually in our practice, we used to see people coming in with difficulties in relationships, or difficulty with diseases, difficulty with healthcare issues and pertaining to conditions which are common in psychiatry. There has been a significant rise in the number of people coming in due to economical issues impacting their daily living.
I've had students who actually have had to drop out of the program because of the degree of anxiety that they've had, that going to the health center and going to the counseling center hasn't been enough. They've actually been so anxious and gotten to the level of such a level of depression that they've needed to drop out of school and go get professional help outside of school. I've seen students' grades drop in the past, and as you said, there's been an increase in this. In the past, I've had students that were even suicidal, that would come in and talk to me because they were so anxious about what was happening in their parents' lives and how that was impacting them, and were they going to be able to finish school or just do what they wanted to do professionally. So it really made a huge difference, and it's become worse over time. It really has.
Difficulty sleeping, difficulty being able to stay focused on their task. They may begin to find themselves struggling with using alcohol or drugs. They may find themselves overeating to compensate for their challenges and anxiety, or even struggling with shopping, even if they don't have money. I just saw a woman the other day. She was close to $80,000 in debt, and really trying to find a venue out of that difficult situation, but still kept on doing it. So folks try to manage it in the best possible manner, which may not be best all the time.
And some other things, people having headaches, things like that?
Yes, well, when you have challenges such as worrying about your children's tuition fees or paying the rent or when the next money is going to come around for paying their health benefits or co-payments and so forth. So we are seeing people struggling with difficulties such as headaches, challenges regarding just not being able to enjoy doing things that they used to enjoy at one time.
Professionally, I have lots of people coming into my office. I saw a gentleman last week who his job has been through one round of layoffs, and he was safe the first round, but he's concerned about maybe another round of layoffs coming. I also have somebody who a lot of people have left his office because they've been offered early retirement or things like that. So it's kind of sad for him as well because he's seeing a lot of people leave that he's worked with for many years. Personally, I was just informed, my mother was informed that her position is being discontinued at her place of work. So she is going to be out of work in the next several months.
Our emotions drive our behaviors. So if I'm fearful, I might do something to counteract that fear. People become very anxious and they may find themselves having a lot of bodily symptoms. So depending upon what you may have, if you seem like having a chest pain, it actually maybe is a panic attack, but you seem like having a cardiac disorder. So people end up in emergency rooms, seeking medical help, and many other ways trying to find, most often will go to their primary care doctors, finding relief for sleep difficulties, anxiety difficulties, and depression difficulties, and so forth, or headaches for that matter. And which is okay, which is an important thing. You need to be able to consult, and also then seeking treatment from their therapist, if that, or reaching out to families and friends and so forth. None of them is right or wrong, as long as it is being able to help an avenue to do some alleviation of suffering.
Unfortunately, I think there is. People often do not come into treatment or get help from professionals until they're desperate, because there's so many worries that go along with that. What if their employer finds out? Will they be judged? What if other family members find out? Will they judge them for that as well? So, the normal worries of everyday life, plus then what to do if you're struggling with mental health issues, is often an issue as well. So people have a hard time with that and often put that off instead of coming in when they first need help.
If your inner resources are being exhausted, but laying under the cover and not doing something which is causing quite a bit of distress is not helpful. So with that said, there's no absolute right or wrong answer. However, if somebody is able to find that in spite of their headaches are not going away, taking Tylenol PM, then you're not, you just aren't getting it, well, then find out some resources which might be more helpful. So often I recommend, having somebody to be able to see a counselor if other venues have not been very helpful. And then the counselor is a good triage to be able to assist an individual, whether they need to be seen for additional treatment by a psychiatrist or an assessment, or maybe not.
Well, we're all unique. All humans are individual and unique, so we don't all handle things in absolutely the same way. Teenagers often can become irritable. One thing to notice with teenagers, if their grades drop at school, or if they're not wanting to go to school and refusing, or if they lose interest in their normal activities, that's something that might give you an idea that something's going on. Older people may become withdrawn and isolative. So it all really comes out in behavior is what it happens, because our behavior is driven from the emotions that we feel and the stress that we're feeling. So it comes out in some different or unusual behavior.
Female are far more expressive of their emotions, which is a good thing, and they're able to let things be known earlier on. Men tend to be a little macho. They want to be able to control everything, and they tend not to seek help earlier on. And when they do, they may express a little bit of road rage, and they may be a little bit, funny in regards to their level of irritability, and angry outbursts and so forth. So that's more common in male, more aggression or tendencies towards that, or less expression. But either way, the struggles are very similar underneath. So men come in treatments or seek treatment later on than women do.